as to what is happening as part of our own duty, and then hopefully your own responsibility combined with ours will protect us and give us the best response. Globally, there is a decline in the number of new COVID-19 cases and deaths. However, the reality is that as people get back to the things they love, and this is not just Jamaica, it is global. A number of measures have been relaxed over the last number of months across the world. So persons are attempting to readjust and to get back to normal as we are here in Jamaica. However, we should not be complacent, and we should recognize that there are challenges still out there, and it does still represent a threat to our health and wellness unless we address the measures or contribute to the measures of protecting ourselves from the virus. So between April 18th and 24, for example, the World Health Organization tells us that the number of new weekly cases increased in a number of regions, including the regions of the Americas, of which, of course, the Caribbean is a part. The COVID-19, therefore, ladies and gentlemen, still does represent a risk, and therefore the management of the threat has to continue. And, of course, we all have a role to play. The BA.2 variant, which is the variant of concern, which is the dominant variant globally, is highly transmissible. And as we had announced a week or two ago, is present in Jamaica. In fact, it's present from as far back as March. In the last 24 hours, Jamaica recorded 115 new COVID-19 infections, and unfortunately, one additional death was confirmed. It brings the total numbers of infection on record for the island to 129,862, and to 2,955, the total number of deaths, tragically so. Also in the last day, Jamaica recorded a positivity rate of 11.6%, which means that our 7-day average represents 8.6%. And as the CMO will explain later on, as she gives her report, it means that we have a trend that is going up gradually, but with some amount of certainty. It's not erratic, it is actually increasing. There are also some 108 persons hospitalized, 22 positive for COVID-19, and another 86 suspected. Of the 61 persons in hospital whose vaccination status is known, only 10 or 16% are fully vaccinated, and 51 or 84% are unvaccinated. And it reflects the numbers in the wider population around vaccination rates, which we continue to encourage and continue to provide as a government and as a Ministry of Health. A ray of hope around the current scenario, which based on positivity rates could be viewed as concerning, but when juxtaposed against hospitalization rates, there is a fairly significant lag between the positivity, the cases, and the number of persons who are being admitted in the hospital. And it says a lot. Again, the clinician represented by the CMO can comment more fulsomely and scientifically on this, but from a statistical perspective and being just descriptive, the positivity rate of about 1.4% under normal circumstances would be concerning, because it means that the spread of the new variant strain and the virus generally is multiplying at a rate that is exponential. And so we do anticipate that a lot more persons are going to be positive or are positive in the coming weeks. But the hospitalization rate remains relatively flat, about 1%. So or 1, the number 1, as opposed to 1.4 for positivity. That's between April 1 and April 27th. And so that for us, certainly for me as the policymaker, is suggesting that while the virus is a more highly contagious virus, and it is spreading and persons are getting it, the hospitalization, the extent of the illness, at least up to this point, and hospitalization is going at a slow rate. And this is a similar observation when we look at other countries throughout the world, including the US, where positivity rate is growing, certainly in the last week, at a fairly rapid pace, over 40%, but hospitalization is increasing by about 12-13%. Again, that will be reflected in the report by the CMO. At the same time, some 2,353, or 97.8% of the confirmed 2,408 COVID-related deaths whose vaccination status we know were unvaccinated. So that's the other takeaway, significant takeaway. So while we can accept, based on the data, that it appears on the face of it for now that hospitalization is at a lower rate of expansion or increase than positivity rate, the facts are that to the extent that you end up in the hospital and get a severe bout of COVID, if you are unvaccinated, the risk of significant damage to you and even death is exponentially higher than if you are or were vaccinated. And so the message is clear. We've said it over and over. Get vaccinated. Vaccines are there, they're available, and it's still the best form of protection. These numbers, as I said earlier, while not alarming, are nonetheless a reason for some caution. This is the positivity rate. They remind all of us to continue to practice as far as possible infection prevention and control measures, frequent hand washing, physical distancing, mask wearing, and staying home if you are ill. And I want to emphasize that latter part about staying home if you're not well, because there are a number of persons in the population who are infected now based on the reproductive rate and are likely others to get infected. If you're not well, you should go get tested, and you should at least stay away from others to protect not just yourself, but those around you. And of course, with the BA2 variant, that will amplify that situation. It is also a reminder to the unvaccinated, as I said earlier, to get vaccinated. Up to this afternoon, Jamaica had 1.415, that's 1,415,488 doses of COVID-19 vaccines. Of that number, 693,095 were first doses, 589,212 were second doses, and 96,532 were single doses. That's of the Johnson & Johnson. The island has also administered some 3,918 doses to immunocompromised persons and given approximately 32,731 boosters. There is no doubt, ladies and gentlemen, that we need to increase the vaccination numbers, and it is a concern for the country, for the government, for the health authorities, and we certainly would want to encourage persons in light of this new variant and the increase in cases, if you are not vaccinated or you have not gotten your booster, to go and do so out of an abundance of caution. At this point, I'm going to invite our Chief Medical Officer to take us through the numbers with a very brief presentation. Thank you.
Great. Thank you, Minister, and good evening to everyone. So our situation now is that we have 129,862 confirmed cases, and this gives us a daily positivity rate of 11.6% for yesterday's data, and a positivity rate, 7-day average of 8.6%, and that is with 115 total new cases confirmed yesterday. We have 2,955 deaths, and our case fatality rate is 2.3%. In terms of the deaths, we see that the over 60s are still the persons that are being affected. Even though we have not had recent deaths, a lot of deaths in this month or last month, we're still getting some confirmed cases coming out of case investigations, and it is still showing that the persons that have been affected mostly for COVID are those that are over 60. In terms of the active cases, we have 539 cases that have been confirmed over the last 14 days. And in terms of the, next slide, the geographical distribution of these cases, we see that Clarendon, St. Catherine, Kingston, and St. Andrew, those being the most populated parishes, will have a high number of cases, but we see that St. James, St. Anne, Westmoreland are cases on the northwestern side of the country where we're seeing the number of cases increasing steadily. And in terms of our confirmed cases by date of symptom onset and hospital admission by date of admission, you will see at the end of this graph, you can see the blue lines that are going up. And this is, as Minister has indicated, that over the last couple of days, we have seen a steady increase in the number of cases. Yesterday, you would have seen a 14.8% positivity rate, which is a high positivity rate. We haven't seen that in a while. And so that represents, the steady increase over the last couple of days. The pink line, though, shows that in terms of admissions, fortunately, we are not seeing an increase in the number of admissions. That is still a flat line, more or less, that we are seeing. And if we look at the confirmed cases by date of onset of symptoms and the hospital admissions, so on looking at the graphs on the left side of the screen, the blue will show you the number of confirmed cases, and you can see that over the last couple of days, those have been going up. But the pink line shows you the number of admissions, and you can see that very clearly that there is a flattening of that line. So we're not seeing the increase in admissions going up as the number of cases being confirmed are going up. On the right-hand side of the screen, we look at the reproductive rate, and again, the reproductive rate is calculated using two parameters, the number of confirmed cases, which is the blue line, and so therefore you see that this is increasing, suggesting that there is more exposure out there, and persons are transmitting, and with a reproductive rate of 1.4, certainly it's a more than one-to-one transmission. It's one person transmitting to more than one person. So the reproductive rate out in the general population seems to be increasing. However, if we look at the pink line, which is the reproductive rate calculated from the hospital admissions, it does not appear to be increasing. If we look at what is happening across the world at some selected countries compared to what is happening in Jamaica, what we would have seen that comparing last week with the week before, and we look at the percentage change in the number of cases, we see that for most countries, and we have highlighted here, South Korea, France, United Kingdom, Greece, Ireland, Canada, we would see that the number of cases have decreased comparing week to week. However, for some countries, for example, Germany, United States of America, Barbados, there has been a positive increase in the number of cases compared to the week before. So more cases in the last week compared to the week before. In terms of hospitalizations, generally on the right side of the screen, you can see there's a negative change. So hospitalizations in most countries are going down. However, we note in the United States of America that the hospitalization increased in the last week compared to the week before, but not to the extent that the number of confirmed cases increased. And so this is reflected in what is happening in our beds, in our hospital. We still see a trending down in terms of the number of persons on beds. So still seeing a positive trend here in terms of hospitalizations. And this is reflected by the fact that we're still in the green zone. And as you would have noticed, that we would have started to do some of our elective surgeries, trying to get our patients back on list, our patients back in the clinics. Of course, adhering to the infection prevention control measures in hospital as much as possible. And our daily positivity rate, you can see it reflected here again in this graph, and you can see that it is going up at the end of that graph. And if you look at it using it by week, you can see that it is even a steeper look that the numbers are going up. However, when you look at the vaccination status of the persons that have died as a result of COVID, we're still seeing that 97.7% of persons are unvaccinated. And this again highlights the importance of being vaccinated, because if the numbers are going up, you're going to have more positive persons. However, if you are vaccinated, you are unlikely to get a severe illness and you are unlikely to die as a result of COVID-19. And this is also reflected in the number of persons being hospitalized. For the most part, the persons that are being hospitalized as a result of COVID are unvaccinated. And this is what is reflected here. In terms of our vaccination program, this is where we really want to motivate persons to go out and get vaccinated, because the vaccination rates, the number of persons coming in for vaccinations are quite low. And the number of persons coming to get their booster vaccinations are also quite low. We're still at 25% of persons that are fully vaccinated and another 4% that have gotten 1 out of 2 doses. Now, if our numbers are going up, we have the potential of more persons with a reproductive rate of 1.4 out there, then more persons are going to become COVID positive. If you are in that vulnerable population, then you can get a severe illness if you are not vaccinated. So let us not contribute to the numbers in hospital going up. Please get vaccinated and ensure that your elderly relatives, friends, neighbors get vaccinated so that we do not suffer the effects of having severe hospitalizations as a result of the increase in numbers. And if you look at this bar chart that is on the screen now, you will see that the persons that have the least amount of vaccinated persons, the age groups, are the 20 to 29 and the 30 to 39. And these are the age groups where we have the highest number of COVID cases. And, you know, these are the persons that will transmit it to the older persons who we still don't have adequate protection in, because only about 55% of persons, 55 to 60% of persons in the 60 to 69 and 70 to 79 are unvaccinated. And so they certainly are vulnerable. And if we have such a wide cross-section of young persons that are not vaccinated, that their numbers of positive cases are going up, it is almost a certain that they are going to spread it to the vulnerable population. And so we must get vaccinated. So just looking at overall COVID-19 indicators, we are still at a low level of geographical spread, but you see that we are edging up to that 25%. That is going to push us over into higher levels of geographical spread. We now have low pressure on our bed occupancy, and that's where we want to keep it. 7-day positivity, a medium transmission level now. We were in low transmission level for a few weeks, and now with our reproductive rate going up, we can expect positivity rates to go up. We can expect geographical spread to go up, but we do not have to have bed occupancy going up if we get vaccinated, protect our vulnerable persons, and stick to our infection prevention and control measures. Over to you, Minister.
Thank you very much, CMO. So there you have it, folks, the report for, as presented by the Chief Medical Officer, the summary as at the 27th of April. Key figures to watch there, all five, but the positivity rate does suggest, as the CMO said, that we will expect more persons to be infected in the weeks to come, the days and weeks to come. And therefore, I say to all Jamaicans, you need to do what is necessary to protect yourself if you do not want to have the experience of having COVID. The BA2 variant, more than likely, as a dominant variant in the population. You need to practice the social distance, the hand sanitizing, the wearing of the mask when you find you're in a vulnerable space. But we do expect that you will see more positivity. And if you're ill, go see a doctor, stay home. The hospitalization is reflecting a lower level and of increase, which is a good thing. And what it is suggesting is that the virus, even though it's spreading, is not as impactful as were the case in the past. Not a reason to be complacent, but nevertheless, that's the data and that's what it's suggesting. And we hope that it stays that way. And then most very importantly, we have more than enough evidence to suggest and support that vaccinations work as an important form of protection. And so we encourage Jamaicans to be protected. Now on vaccinations, Vaccination Week of the Americas is this week. And I want to take the opportunity to remind members of the public that vaccines, including COVID-19 vaccines, are safe. Each year during this time, we celebrate Vaccination Week, and it's really about immunization, not just for COVID-19, but for all of the diseases that we have vaccines for. It provides us with the chance to reflect on the public health value of vaccines, including our COVID-19 vaccines, and the protection it has offered us as a people, as a country, in terms of our Human Development Index, life expectancy, and so on, against diseases like polio and other such diseases that we have had in the past. It protects the elderly, it is safe, and it protects pregnant women, persons with underlying conditions, and we have quite a number of Jamaicans, the cardiovascular disease, hypertension, diabetes, cancers. You are the key vulnerable targets, and therefore are the ones who should get vaccinated as part of your protection, because your immune system is already compromised and therefore would be in more danger should you get the virus. I want to remind members of the public that Jamaica has a largely vulnerable population. I speak in the sectorial debate, all being well, on Tuesday of next week. And I will use the opportunity to outline some of these details around our population and the health profile of our population. But in summary, we have a sick population, and sick in terms of clinically ill, in terms of underlying conditions. 1 in 3 Jamaicans are hypertensive, the high blood pressure. 1 in 8 diabetic. 1 in 2 obese or overweight, increasing their risk of developing a lifestyle or non-communicable disease. Those are the realities, not an opinion. And as a consequence, it is reflected in the rate of death from persons who have had COVID. The majority of those persons, as I like to say, because it is a truism, the extent to which persons who died from COVID were already sick because of an NCD is alarmingly high, and it shows the correlation between the two, as well as the unvaccinated. Many Jamaicans have these illnesses because they are unaware of their health status. 4 out of every 10 people, for example, according to the Jamaica Health and Lifestyle Services, are unaware that they have a particular condition that they have. And that's because as Jamaicans, we do not take time to get the checkup, to go see the doctor, to get the annual medical. We call it checkup. And that's something we need to encourage, because it is in knowing your health status that you can adjust your lifestyle practices, the foods you eat, the exercise, and so on, to control any condition that you may have or may be vulnerable to. That said, it is impossible to predict who will get serious infections that may cause hospitalization and death, and therefore vaccines are important. So vaccines work. Routine vaccination in Jamaica and around the world has protected us against serious preventable diseases, things like tetanus in newborn, measles, rubella, polio, and of course COVID in the case of COVID-19. We continue to have a wide cross-section distribution of COVID-19 vaccines. 104 of our health centers island-wide, 28 in the Southeast Health Regional Authority, that's KSA, St. Thomas and St. Catherine, 14 in the Northeast region, Portland, St. Anne and St. Mary, 34 in the Western region, that's Hanover, St. James, Trelawney and Westmoreland, and 28 in the Southern region, that's Clarendon, Manchester and St. Elizabeth. And there are also 21 private vaccination sites in operation and 16 private doctors administering vaccines. So really there is no excuse, no matter which parish you live in. You just have to reach out to the public health parish office, which is listed, and just ask, where can I go to the nearest vaccination center? There has been further, in closing, easing of restrictions as we seek to coexist with COVID, and I know a lot of persons are concerned about that. But we, I think, have spent some time explaining why the government has taken the decision it has taken, and we're prepared to do so again. The truth is, none of those positions that have been taken are unusual in the case of the globe. Most of the world have gone in that direction in recognition of the need to address some of the other glaring challenges that societies face around the world. It is important, though, to recognize that as individuals, as Jamaicans, we must assess our own risk, our personal risk. And where masks we think are necessary for our own protection, we should wear it, or for the protection of others, if we're sick, if we're sneezing and coughing. And, where we need to stay at home, if we're not well, we should, until the doctor says otherwise. And, the sanitizing and so on. So there is a lot that is riding on the individual response for the collective good. Very, very important that we demonstrate that level of responsible approach while we attempt to deal with some of the other critical things within our society, like getting our children back to school, getting people back to work, and so on. We continue to make our best efforts as a ministry to do what is necessary. We've not let up on the health education, the vaccines availability, the advice, the testing where necessary. All of this continues, and I really want to pay tribute to our health workers who have been at this for over 2 years, well over 2 years, and have not let up. So despite the relaxation, we are still monitoring the situation, and we'll continue to monitor, and we'll continue to keep the country updated as to what is happening. So please, protect yourself. We do have increase in numbers, not increase in hospitalization, not a reason to panic, but certainly a reason to be concerned and to offer self-protection. Thank you very much, and I hand back to you now, Petrie.
At this point, we open the floor for questions from members of the media, and we invite you to use the raised hand feature in order to submit those questions. Our first question this evening comes from Rox Roy McLean of The Star.
Good evening, colleagues. Good evening, Minister Tufton. Good evening, CMO. I have a few questions. Given the positivity rate at the moment, was the lifting of the mask mandate ill-advised? That's one. Two, is the Ministry of the view that it needs to start curtailing, the movement of people again, considering the positivity rate? And three, how much does the ministry attribute the rise in positivity rate to the reopening of the entertainment industry? And my final question, do we need to revisit the policy allowing people entry into the country without COVID pre-testing? Those are my questions.
All right, so you've certainly taken advantage of the opportunity. 4 questions in, all right. So these are all policy issues, clearly. So I'll make an attempt to respond, granted. Firstly, let me say that there is a level of risk in every decision that is taken. And we start from the premise that we recommend or make policy around the COVID response that attempts to balance the critical interests that combined makes up a society and how a society functions. But there is also recognition that in making that decision, there are risks or levels of risk that are involved. So all of these that you have said here comes with some level of risk. But the opposite in terms of the need to balance and the need to achieve certain other things which we were not achieving before also has been taken into consideration, which we hope will bring some greater benefit or address some other underlying issue. The general response is that we need to get back as much as possible to normality, because after 2 years, we were really under stress as a society. There were several side effects affecting our economy, our country, our children not going to school. And so the relaxation was intended also in keeping with an assessment of the COVID risk to achieve that balance. So the mask mandate, firstly, is not a recommendation not to wear a mask. The mask mandate removal is a policy that says you don't have to, but if you think that you need to, you should assess and wear your mask. And therefore, while there is a risk by saying you don't have to, the management of that risk is up to you to say, I will where I think I'm at risk. And I think that is an attempt at balance and an attempt, while doing the restriction removal, an attempt at getting back the normality that we all seek and desire for other benefits. The restrictions around persons coming in, again, I don't, as of now, see us going back there, because if you note, we gave a context of the world, and we saw where positivity rates went up in a number of countries rapidly. And in this case, currently, a number of those countries are seeing a decrease in positivity. So while we do think that our positivity rate will go up further, as of now, and it is a moving and evolving situation, we suspect and we hope that that trend will similarly follow as it has in other countries, where it will peak eventually and then decline, with a not so steep corresponding increase and decline in hospitalization. And we did say in the past that the future dispensation is not so much about positivity, it is about hospitalization and deaths. Those are the figures that we are watching and will continue to watch. And as of now, every death is one too many, but the numbers are far lower when compared with the positivity. So I don't see us, I don't think we should live in regret as it relates to the lifting of those restrictions, but we will continue to monitor as we go along. In terms of the entertainment industry, it's a similar scenario. The entertainment industry was shut down practically for the better part of 2 years at much cost, social cost, economic cost, and to remove restrictions and keep entertainment closed would, frankly speaking, be a highly inequitable position, and clearly not address the balancing that we sought to achieve when we decided to take those measures once we saw the decline of the last wave. So again, there are risks, but we felt, the government that is, that it was worth taking that risk at that particular point in time. That doesn't mean we won't continue to review and adjust if necessary, but we do believe that that risk was worth it. And I believe the numbers are supporting that, because while positivity is going up, we don't see a corresponding increase in hospitalization or death. And then the issue of reviewing of persons entering, I think I had addressed that question before. Very long-winded response, sir, but these are not uncomplicated issues. Not saying that we always have it right or get it right, and I'm not saying that there isn't a risk with every decision that is taken. But it's a matter of how we calculate that risk and balance those risks that are involved in all the decisions that we make. Thank you.
Thank you, Minister. Our next two questions come from Debbie Ann Wright of RGR. At the first, it says there was at least a 7-week gap between the taking of samples and confirmation of the Omicron subvariant in Jamaica. Why did it take so long for the ministry to confirm the presence of the subvariant, given that testing is now being done locally? And 2, is the ministry revamping its approach to getting people vaccinated, or will you continue with the current methods which appear not to be working?
Yes, we did have some reagent supply issues early on in the early part of March that would have caused a delay, but we are back on track in terms of the testing. But we did, in our conversations, indicate to persons that even though we had the BA1 as a dominant variant, that just knowing that it had become the dominant variant in the US and in our neighboring countries would suggest that the BA2 would be here. So, in terms of our preparations and the precautions, then those would have been in place, and that's why we do maintain that we need to have the infection prevention and control measures. So we did have a gap, but it was because of a reagent supply, and now we're back on track.
The vaccination approach question, CMO.
Well, certainly in terms of getting persons to get vaccinated, we're here at the press conference today. We haven't had a press conference in a while, and this is one of the reasons why we thought it was important to come out today to speak to the public, because we need to re-emphasize our position on vaccination and on the uptake of boosters. So yes, we are speaking out more about this, and we are trying to focus. Certainly we have vaccination being offered in our health facilities still. We are looking at how we promote this among passerbys who will not know, because they're not seeing anymore the long lines and wondering if vaccination is going on. So we're looking at more signage to get persons into our facilities, and we continue to advertise on our website where it is that persons can take up vaccines.
Thank you so much, CMO. The next question comes from Asho Wilkes of The Gleaner. Asho?
Hello, good night, everyone. My question is for Dr. Tufton. 2 questions, actually. So firstly, did the ministry give the government their approval or make any recommendations for the mask mandate not to be removed? And is the health ministry concerned that with the withdrawal of the mask mandate and other DRMA measures, as well as the arrival of BA2 variant, that hospitals might be flooded with COVID cases as summer months approach?
Okay, thank you. So the discussions around cabinet and advice given and what type of advice and so on are not issues that I'm prepared to discuss publicly. we provide pros and cons of every decision as a ministry to the cabinet. The cabinet makes a decision, and that decision is, until otherwise, sacrosanct. That's a decision that we stick by and we work with unless and until there is a review and a change. As I've explained earlier, all the decisions that we take, whether to keep the mask or to remove the mask, comes with a certain level of risk. I've not spoken about the mental health impact, for example, on the restrictions, but there's a big impact. I will address some of that in the sectoral next Tuesday. So the point is that the decision was announced, was taken, and was taken in the context of a general position that we needed to restore a sense of normality to the society, to the economy, to the country, not just for economic purposes, as important as that is, but psychosocial purposes also, because of the impact of some of those restrictions. And also based on the assessment of where we were in the COVID response. So there was also a clinical assessment. So that's as far as I'm prepared to go without breaching the confidential discussions that take place at Cabinet. I don't recall what was the second half of the question, or did I answer both?
Ashok, can you, the second question is answered, correct?
No, the second question was whether or not the ministry is concerned that with the withdrawal of mask mandates and other DMR measures, as well as the arrival of the new variant, that hospitals might be flooded with COVID cases given the summer months approaching.
Well, we have seen from the report that up to this point, the increase in positivity, 1.4%, which is a fairly aggressive increase, is not equating to a similar increase in hospitalization. And indeed, on a global scale, when you look at the countries that we have looked at, it is also suggesting that that is not being reflected. In other words, the virus is not having the kind of impact that is placing persons in a hospital at the rate of the positivity increase. So that should answer the concern that you have expressed. I'm not saying this may not change, which is why it's important to monitor. And indeed, I think the government will be responsible in its approach, where if it becomes an issue around hospitalization, overwhelming the health system and so on, then clearly if you see things moving in that direction, then you have to adjust. And the government has always been willing to pivot in this pandemic because, as I said, there's no playbook. So we adjust as we go along and as we assess the risk that is involved at the particular point in time. Thank you.
Thank you, Minister. The next question goes to Zara Burton. Zara?
Hi, good afternoon. I wanted to find out, CMO, please, how many of the new cases are import cases? Any?
I don't have that breakdown now, but I mean, we certainly do see imported cases because we do get the notifications from countries through their international health regulations, obligations. So we will get the notifications, but I don't have a breakdown in terms of the numbers that from our confirmed cases.
Thank you, CMO. And the last question this evening goes to Jamaica Social.
Hi, good night, folks, and all the best. Are you hearing me?
Good night. Yeah, we're hearing you. Go ahead.
Yeah, good night. This question is for the CMO. I just want to get an understanding of what her thinking or what is the ministry's thinking on a second booster shot, as we see many countries around the world saying that no, a second shot is almost going to be standard for because of Omicron? What is she, or what are her technocrats telling her?
Okay,
Thanks.
so we are reviewing our position on that currently. So our team will look at that. We have recognized that some countries have started to give a second booster, and for persons they have indicated the age group. Some it's over 65. I see some as low as over 50. So we are looking at that, and we will make a position on that, Claire.
Thank you, CMO. Thank you, members of the media. At this point, I hand back over to our minister.
Okay, so thank you very much to all who participated in this COVID conversation. Really appreciate the time, the effort, and the interest. And we appreciate certainly the coverage so that the public can be kept informed. The general conclusion is the obvious data suggesting that there is an increase in positivity with the BA2 variant strain of COVID being the dominant strain. It is highly contagious, so persons should act to protect themselves. If you are feeling ill, you should stay at home, you should consult your doctor, you should get tested. And there are tests available right across the country. And you should assess your circumstances and situation and protect yourself. The other news is to approach this in a manner that gives protection and operates out of caution, but not in a manner that raises panic, because the numbers are not suggesting a parallel increase in hospitalization, and that's the target that we're watching. Not to be complacent, but that's the current state of play. We do expect more persons to be contaminated with COVID in the coming weeks, so it may get worse before it gets better. And so we ask you to protect yourself as you go along. And then finally, of course, is vaccination. Let's get vaccinated so we can give ourselves the best form of protection. Thank you very much, and have a good evening, and we will continue to keep you informed in the weeks ahead. Thank you.